have dementia or Alzheimer's, their level at times is affected by that disease process. Validation. We never want to be in groups with a resident and tell them that they're not seeing things or they're not, we want to validate their feelings. We want to express and have empathy with them. Reminiscence therapy could be, get out photos of it when they was in the war, or their kids when they were born, and share scrapbooking, or perhaps there is songs that they bring them back to a time in their life. Music therapy. Our activity therapist is wonderful. She'll come in, she plays guitar, the bongo drums,
cool.
They do singing. They have a time with music therapy. Activities of daily living, we're helping them take care of their basic needs, and it's wonderful. Sometimes just their hands need to stay busy. So, okay, here's 20 washcloths. You can fold, and they feel that sense of accomplishment while they're in there at times. And then extensive discharge planning and coordination. When they come to our facility to get help, we want to make sure that when they walk out that door, or they're taken back to the facility that they came from or back home, that we have a plan in place to make it successful upon their discharge.
Well, that kind of goes into my next question, is what happens when they are discharged? So
the discharge planning process actually starts at admission. Sometimes it takes a little bit of time to get some services in place. Our social worker is on the unit, is meeting daily with the patients. Whether or not they're from an extended care facility, an assisted living facility, or home, whatever the case may be, we want to make sure that we can get home health. If we need physical therapy, occupational therapy in there, we want to put those services in place. Perhaps they just need someone to take them from appointments back and forth. But that social worker is the connection piece there with that discharge process, so that they are successful when they do leave the facility.
Wow, that's really amazing. A lot of interesting stuff that you guys are doing over there. To sum it up, what are some of the things that is unique to our unit over there?
What I think is unique is a lot of behavioral health units these days are grouping adults, geriatrics, they're grouping them all together. And that does not really provide a very good means of a therapeutic environment. So, if your 85-year-old grandma is admitted to our unit, you can rest assured that there's not going to be that 35-year-old burly psychotic man in there that could harm or scare your grandma.
Well, that's definitely good to know. Since you did touch on that separation there, can you tell us more about the child and adolescent side of the care pavilion?
Absolutely. The geriatric side, we just got that open, up and running, but right there also is a little gym all in itself. We do have a 30-bed children and adolescent unit. We service ages 6 to 18 years of age with a multiple passel of psychiatric diagnoses that they could have. They have to, for admission, be a danger to themselves or others within the last 24 to 48 hours. We see anything from depression, bipolar, attention deficit, hyperactivity disorder. Maybe they've had some issues at school. We see, as of late, some of self-harming with cutting, some that have tried to overdose. So there's a whole gamut there with that. Our acute unit is the 8-bed unit, and typically they're there anywhere from 3 to 5 days. We stabilize them, get them set up on outpatient therapy if they're not already in the therapy system. Maybe start medication, or sometimes adjust medications as well. As a nursing professional, I don't always feel that a pill is the answer to everything. I feel that you have to look at the whole system there in place and make decisions without just giving someone a pill. Referral sources, the Fayette County School Corporation does a lot of referrals for us. Department of Children's Services. We get children in from adoptive families, foster families, or just homes, just regular homes that's having some difficulties. And then our residential side is a more long-term placement. Average length of stay is 6 months. And they work on short-term, long-term goals. And from there, we put them back into their homes or reunify them. And most of the time, they're followed back through with outpatient therapy. We do have a full-scale outpatient services as well there at the Care Pavilion. Right there on that corner of Erie Avenue, and there's just so much help right there in that building, whether or not it's your 6-year-old child or it's your 85-year-old grandmother. So those services are there, and until someone needs those services, they're overlooked quite a bit. And with mental health, it carries that stigma, but we're there to help. And I'm just so glad that Fayette Regional has seen this need to enhance these behavioral, and on that unit as well is Dr. Osman. He's the medical director as well. So we have that connection as far as that continuity of care from different age groups too.
Go ahead.
I had a question. Now, I understand there's an adult outpatient on the other side. Is that correct?
There is adult outpatient.
Okay. And then the child and adolescent, are those only admitted from Fayette County, or do you extend into other communities as well?
No, it's other communities. We have all throughout the state of Indiana.
Okay.
Our intake process for that is much the same. You call into the Fayette Regional Care Pavilion, and there are some questions, not quite as extensive as for the geriatric side, but then the determination is made of whether or not they meet criteria for admission.
Okay.
Well, bringing up the point that you do have the child and adolescents, perhaps the middle-aged adult, and then your seniors. Is this an open facility? Do they all intermingle, or are they isolated, separated?
No, each unit is distinct in itself. They may be housed in one building, the Fayette Regional Care Pavilion. However, on one side is the children and adolescents, and the other side is the geriatrics. They are both in locked, secured areas.
Okay.
So there's no intermingling or anything of that nature. And then right in the center of that is the outpatient services that come and go.
Oh, okay.
So safety is ensured, and then separate programming is on each unit.
Okay. Well, I'm sure that really gives the families a lot of peace of mind, knowing that they are in a safe, caring environment. Thanks so much for joining us today. What an interesting story that you guys have to share with the Geri Psych services over there.
Thanks for having us.
Fayette Regional is your community hospital, serving the local area for 100 years. Founded in 1913, Fayette Regional has been providing great health care to the Whitewater Valley for a century and giving back to the community with outreach, support, and donations, as well as employing over 600 people in the local area. Fayette Regional, your community hospital.
Welcome back. Charity, you mentioned earlier that Fayette Regional is hosting a health fair on November 2nd. Can you tell us more about that?
Sure. We are hosting our annual free health fair on Saturday, November the 2nd, from 8 a.m. until 12 p.m. in the Miller Building at Roberts Park. And a number of our local agencies are going to be on hand this year, including the Eye Center of Connersville, the Fayette County Public Library, Fayette County Cancer Society, and today I got the phone call from the school corporation. They'll be joining us as well.
Good.
And lots more. And everyone's just going to get together and help educate our community in the areas of health and safety, and providing a variety of free screenings. And some of those screenings that we're going to have are cholesterol, our blood sugar, blood pressure, some bone density, and a lot more. There's going to be lots of door prizes and giveaways at every booth. And last year, Sparky the dog from the Connersville Fire Department was on
Great.
hand to interact with the kids. So I'm really hoping that he'll be there again this year. And so it should be really good.
Sounds like this is going to be a family-oriented event.
Absolutely.
Love-
Kids, parents, grandparents, just everyone in the community is encouraged to come out and enjoy this free health fair.
Great, sounds great. If your organization would like to participate in the free health fair, please contact Charity by calling 765-827-8058 or emailing her at charitym@fayetteregional.org. That's all the time we have today. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Doug Fischesser.
And I'm Charity Moore.
Stay healthy, Connersville, and if you're not, stop by and see us.